Hello everyone, Dr. Parley Anderson here, physical therapist and author of the book, All This Sitting is Killing You. Today I want to talk about the lumbar spine, and specifically lumbar spine stiffness. Stiffness is often a precursor to the onset of low back pain or sciatica, so having a flexible spine will help protect it from getting pain and shooting type of symptoms, sciatica-like. So I want to look at range of motion and identify what might be limiting that range of motion, and then give you some simple and easy strategies to help restore mobility to the lumbar spine. So the first motion I want to look at is called lumbar spine flexion. And what you do is set your hands on your thighs, keep your legs nice and straight. Let me see if I can create a little space here so you can see me better. There we go. So hands on your thighs, keep your legs straight, and there should be a nice amount of excursion as you reach down towards the floor. The curve of your spine should reverse. Don't bend your knees as you reach down. This is lumbar flexion. The opposite motion is extension. And to look at that range of motion, you're going to stand comfortably, hands to the back of your hips, and what you want to do is tilt your spine backwards. Again, there should be a nice excursion. And again, keeping the legs straight as you lean backwards. Don't bend your knees. Good. Lumbar flexion. Again, there should be a nice, good amount of excursion. And then let's look at lateral flexion or side glide. So stand relaxed and kind of keep your shoulders still. Just see if you can kind of slide your hip over. And see how my spine is kind of tilting to the left as I do this. So this is left side glide or left lateral flexion. And again, look at that excursion of motion. There should be a good amount of mobility through there. And then let's go the opposite way for right lateral flexion or right side glide. So all those motions should be fairly free and not a lot of resistance to the movement. So let's go back to lumbar flexion. What happens if it's stiff? I can only reach down to here and it's stiff and it won't go any further. What could be limiting that? Well, tightness of your lumbar spine, tightness of your posterior hips, your glute muscles, and tightness of the hamstrings can all contribute to that. So what do you do to improve on your flexion range of motion? And one other thing to think about too is some people have really long arms and really short legs, and it's real easy to touch the floor. So some people have longer legs and shorter arms, making it a lot more challenging. So it's not so much can you touch the floor or not, it's can you get a good amount of excursion through the movement, and the movement is fluid and easy. So limiting factors: tightness of the lumbar spine, muscles, the joints of the lumbar spine, tightness of the glutes, posterior hips, and tightness of the hamstrings. Well, if it's a lumbar spine, a good strategy is to lie down on your back and just pull both knees towards your chest. And again, I like stretching with motion. Stretch on, stretch off. Stretch on, stretch off. Stretch on, stretch off. Yeah, do that 12, 15 times, do that a couple rounds, and then kind of recheck that motion. And if it's a lot easier, a lot more fluid, and further, then it's probably your lumbar spine that's limiting that motion. If it's your glutes, your posterior hips, a good strategy is to pull one leg towards your chest while you keep the opposite leg straight. And again, it's stretch on, stretch off. So this is going to get more of the posterior hip musculature, especially the gluteus maximus muscle. And do 12 or 15. Do both sides. Make sure you keep the other leg straight. It'll help improve that target area stretch. Stretch on, stretch off. Stretch on, stretch off. And then recheck that range of motion again. And if it's significantly improved, then it's probably more your posterior hips that are involved. And then finally, your hamstrings. I don't like the traditional, this kind of stuff. Oh yeah, here I'm stretching my hamstrings. Well, that puts a lot of strain on that low back to hold that position for a long period of time. Same thing kind of here as I'm leaning forward, I'm compressing the spine as I force it forward. Again, just putting a lot of strain on it. So the way I like to stretch hamstrings is lying on your back and using a strap, a belt, a towel, and keeping the knee nice and straight, the leg that you're stretching, and just pull for a stretch. And again, I'm kind of pulling this way to lengthen that hamstring while I keep that knee pretty straight. You'll feel it as you straighten that knee. And again, stretch on, stretch off, keeping the opposite leg nice and straight while you stretch on and stretch off. And again, do 12, 15, do both sides, and then reassess that range of motion of flexion to see if that improves it. And if it does, it's more hamstring tightness that's limiting. Sometimes it's one specific area, but oftentimes it's a combination of tightness of the low back, posterior hips, and hamstrings. All right, let's look at extension again. If you have tightness in your abdominals, that can kind of help limit your ability to extend. But oftentimes it's a function of, doing this for a long time. Your body likes to adapt to what you do or what you don't do. If you do that a lot, sit a lot, here, let's make it, there we go. If you do that a lot, which we do a lot, is sitting. What that can do is really stiffen up your ability of your lumbar spine to extend backwards, especially through the vertebral joints. That's what I'm trying to say. The vertebra, the disc joints that are elastic to help move that lumbar spine in extension. And I would say that's probably the number one factor, that tightness of lumbar extension, that I see in patients that develop lumbar spine problems. So how do you restore lumbar spine extension? And where do you start? It's how does this feel? Like, how stiff is this? Some people are like, how's that? I'm like, well, that's not good. There should be a fluid amount of motion, but if it's pretty rigid, like you don't want to move, I would suggest probably starting with just kind of laying prone, and even kind of throwing a pillow underneath your hips there, And just lay here for a couple minutes. And that puts the lumbar spine in a position of extension because you got gravitational forces pushing the spine down. So you lay here for, 2 or 3 minutes, walk around, do another 2 or 3 minutes. And then go back and recheck that movement, see if it's improved at all. And if this doesn't feel like it's anything at all as far as a stretch to your spine, maybe you have a little bit more mobility than that rigid, then I would suggest doing a little bit of what we call elbow press-ups, where you kind of press up through your elbows, little mini cobras. What's important here is that the body's relaxed and you let your spine kind of arch. And totally relax the hips, don't tighten the glutes. Breathe and relax. A fluid, easy motion. Do 12, 15, walk around, do another 12, 15, then reassess this. Is this better? And if it is, then that's probably a good stretch to start. If it's kind of the same and you felt like, well, maybe I can push farther than that elbow press up, then maybe go to full press ups, a full cobra stretch. And how do you position your arms when you do that? You need to be able to lock out your elbows and relax your hips while you do that. So if you're down here and you're like, that's not going to be a real good press up. Relax your hips, move your hands higher up to make it a little easier to do a full press up. And when you do a full press up or an elbow press up, you need to feel a little bit of strain, a little bit of stretching going on. There you go. Let's try a full one. There you go. What's important, again, is to relax the hips. You're not doing a plank. Relax, breathe. Do 12. Walk around, do another 12. And reassess. How's that? Is that looser? Is it more fluid? Is it easier to do? And those are good strategies to work on to improve extension. If you have arm problems, where maybe shoulders, elbows, or hands, or you're not able to do that with your arms, you can do something like this where you just stretch on, stretch off. Stretch on, stretch off. Again, just working that motion and how far. Again, enough where you feel a stretch or a strain, but not necessarily pushing so hard in that stiffness that that hurts. Well, maybe don't go that far. It's got to feel more of a stretch or strain than pain. And then our side glides. If we're tight, tight. How's that? Ooh, not good. How can we work on restoring this mobility? I like to do what's called a little rotation of your lumbar spine. And people talk about spine injury and, you shouldn't do rotation. Well, it's really rotation with compression. Think of getting that compression of your vertebra and then doing that to it. That can definitely cause problems. And that's kind of when you bend and twist and stuff like that. Like that puts a lot of strain on your intervertebral disc. So to minimize strain, but also to work on improving your side glide, your lateral flexion, I like to do rotation lying down where you're in a gravity minimized position. So this is my left side, and if this side is the tight side, what I want to do is kind of bend my knees real good, keep my left shoulder down, in this case I'll hold, and then just drift my legs over for a stretch. and then kind of bring it back to neutral. Stretch on, stretch off. And you don't want your shoulder coming up. And what this is going to do, it's going to rotate, let your pelvis rotate, and that'll effectively stretch all through here, that left side of your lumbar spine. Don't have your legs way down here, that won't get as nearly as good a stretch. Bring your legs up nice and tight. Turn the hips for a stretch, and then relax. And then stretch and relax. And then come on back up, and then if that left side is the tight side, you should notice some improved fluidity and improved range of motion of that movement. And then if it's the right side that's affected, more tight, you're like, this feels great, but this is kind of stiff. And you go down and keep your right shoulder flat, bend those knees again, and now you're drifting your knees over to the left, letting your pelvis rotate, and that's going to effectively stretch all through that right side of your low back. So again, these strategies are for more stiffness and range of motion and figuring out where is my spine not moving right and how can I improve that range of motion. If you have actual spine pain or sciatic pain, some of these movements might actually make your problems worse. So always proceed with caution if you do have low back pain, if you do have sciatica stuff, proceed with caution on these movements. But if you just have stiffness and that's it, then these are really good strategies to help restore range of motion. And a flexible spine is a healthy spine. Hope that helps. Dr. Parley Anderson, take care.